Hey, Ogden Air Logistics Complex, this is Gen von Hoffman. Thanks for tuning in. I'm here today with Colonel John Eberlan, the 75th Air Base Wing Commander, and Dr. Pepper, our Ahmed flight lead with the 75th Medical Group. And we wanted to talk to you about preventing the COVID-19 transmission, the coronavirus transmission, and specifically talk to you about the wearing of masks. We've seen an increase in the cases in the local community and across our base. So we wanted to take a few minutes to address it with you. So with that, we've got a few questions of our experts here, and I'll start with Dr. Pepper. In the early weeks of the pandemic, we really weren't encouraged all that much to wear masks in the beginning. What's the change now?
So in the beginning, the only masks that were available were the surgical masks, similar to this one, and the N95s. And those were all in the hospital supply chains. And we didn't want to completely wipe out our hospitals with those masks. So initially the guidance was not to wear masks. Quickly scientists gathered studies and comparison studies on masks and actually did some studies on cloth masks. And they found that cloth masks were actually really effective in stopping the droplets. So with that, they quickly changed their guidance, and as we all know, the mask production went up, and even here in the complex, they produced masks. So now that the supply demand is no longer there, and we have plenty of masks, it's highly recommended that we wear masks if social distancing can't be maintained. I think the key with that is the social distancing. In my clinic, we can't maintain social distancing, so we wear masks throughout the day. Another example of mask wear, for instance, this weekend I'm going to go mountain biking. I will not be wearing a mask while I'm going down the trails. But I will have a mask in my back pocket, so when we're at the trailhead and we're telling lies after the ride, we will be wearing masks because any one of us could be an asymptomatic carrier, spread the virus, and I would hate to tell yourself or Colonel Eberlan that they lost a physician or 8 troops or 8 employees because of something that was easily preventable.
So thanks, Dr. Pepper. So that brings up the next question that I have. What's the data supporting the combined social distancing and mask wear, and what's the difference and how drastic is that?
Yeah, so there was already hundreds of studies that already existed prior to this pandemic on other coronaviruses such as SARS, MERS, and even the common cold virus, with mask wear and social distancing. So that's where a lot of that initially came from. I think with this virus, though, they did something where they combined all those studies, 170 plus studies, they combined into one study called a meta-analysis. A meta-analysis looks at all the studies combined, and I've never seen a meta-analysis so clear that social distancing, mask wear, and even eye protection all help prevent the spread of the virus. With that, there was another study that just came out of Beijing, China, which showed a reduction of 75 to 82% if mask wear is done in transmission of the virus. For instance, if right now we have social distancing, 6 feet, if we weren't able to maintain that, and I think the thing that I worry about is with this virus, there's so much asymptomatic spread of the virus. And if I were to come into this interview, I feel fine right now. I'm not coughing, but I could still be spreading the virus. So if we're not maintaining this distance, we're not wearing masks, we aren't doing all the other things like washing hands and not shaking hands, I could be spreading the virus to yourself and Colonel Eberlan. I would hate to see what my career would be if I got both of you guys sick with the virus.
Yeah, so you kind of address it with that, but I'll throw it out there. I hear a lot of people say, hey, wearing a mask is my choice and I'm willing to take the risk. But can you tell us how that choice puts other people at risk?
Yeah, just like we talked about, it provides me some protection if I wear a mask, but the better protection is for yourself and Colonel Eberlan as we sit here right now, or if we're within 6 feet distance. That's where the protection really occurs, and that's where the evidence really shows it stops those droplets from spreading, and those droplets contain the virus.
Yeah, so thanks. So Colonel Eberlan, I'll turn it over. The next question to you, because that's the great thing. So tell us about what exactly is the policy for mask wear here at Hill.
Yes, ma'am. We, the DOD or Department of Defense policy, you wear a mask if you can't maintain 6 foot of social distancing. So either you're socially distanced 6 feet or you have a mask on. There are places on the installation where it's 100% mask wear. The BX, the commissary, the golf course clubhouse, just to name a few. And unless there's a specified policy for a specific work center, it's wear a mask if you can't maintain 6 feet social distancing, which is completely in line with what the Department of Defense put out. During this process, we have seen some creative mask or mask cottage industries pop up where you see some cloth masks that have this little round filter on the side, and that got our public health put out a directive talking about those kinds of masks. The problem with those types of masks is a large majority of them allow unfiltered air to come out, and although it makes it easier to breathe, the air that's coming out of the mask is unfiltered, and you're putting your coworkers in danger.
So thanks. Most of our employees have returned back to their offices here on the base or the production areas as we've made provisions and countermeasures to control distancing. We've enhanced cleaning contracts, provided hand washing stations, hand sanitizers, and masks. Can you talk to us, I know we can't talk cases, specific numbers, but can you talk to us about how those mitigations are working here on Hill and then versus how they're working in the local community?
Sure. So in the beginning, the positive test case rate outside of our installation, it's been running anywhere from like 4.5, and the newest release in terms of data for positive test case rate, like across the state, is a little over 6%. Now, early on, we were probably 2.5 to 3% below what the case positive rate was in the state. However, recently, with the increase of cases across the state and with Weber Morgan counties and Davis County, which are close to the installation, we've seen that number close. So the state's a little over 6%, and we're right at a little over 5%. So the percentages, we're getting more in line with the state. However, we are still below the state average, and I think it's because of people wearing masks and maintaining social distancing and being respectful of each other and trying to take care of one another's teammates. Outside the installation versus on the installation, the state they are a little more liberal in terms of what they allow in terms of people sitting down and having dinners, where we're takeout only in terms of food operations across the installation. The biggest difference between where the state's at and where the installation's at, the state's got an economy to worry about. We're trying to preserve mission here on the installation. And what I will say is the same thing that's been said since the beginning. Good personal hygiene, wash your hands, use hand sanitizer, maintain social distancing, wear a mask, but and probably most importantly, that it doesn't get said enough, if you have any kinds of symptoms or don't feel quite well, just please stay home. Don't come to work.
Dr. Parker, one quick follow-up. What would you recommend for those who are in the CDC-defined high-risk category for mask wear, these masks versus N95 in our workplaces?
So with these populations, the worry is that if they get the virus, they're at higher risk of complications from the virus. So mask wear for them is essential and highly recommended. N95 isn't optional, that they can wear it. There is some training that is required. Although I would say the N95 is a difficult mask to wear, it is actually a respirator. And if you've worn one for any amount of time, they are tough to breathe in. And they're really only designed in a hospital setting where you go into a patient's room on a time frame of a few minutes versus an entire shift. So if you do elect to use an N95, you should have a backup. So if you can't tolerate the N95, have another mask available. But the important thing is wear a mask, and as coworkers, wear a mask around these people, because like we said, we're preventing the spread of the virus by wearing the mask. And if you can prevent the spread to your coworker who has one of these conditions, that's the best for them.
Yeah, so thanks. So I'm gonna say thank you again for everybody that has tuned in. I'm gonna ask a big ask here. Please share this with whoever you can, and especially share it with anybody across the complex, across the wing. Colonel Eberlan, Dr. Pepper, and I are pleading and asking that you continue to practice the countermeasures that we talked about, that you already know, and that we've been so vigilant up until this point. We have seen a spike in cases in the local community. We want to control that number on base. The good news is, you agree, Colonel Eberlan, the data suggests that the cases on base are mostly community transmission, not on base transmission. Yeah. So please, let's try to keep it that way. These countermeasures work if we do them. And then the last thing is, this is really about you taking care of your coworkers and really caring about each other as airmen, and it's also about our mission. We need you all coming in well every day. That's it, out here. Thanks.